All right, let's dive into something that's on a lot of people's minds: medication during pregnancy and breastfeeding. It's a huge topic, right? Because even something you might think is harmless can have a big impact on a developing baby. So, we're going to break down how to navigate this really tricky situation.
So here's the thing you absolutely have to understand from the get-go. Just because you're pregnant doesn't mean health issues take a break. Far from it. Women often need medication for all sorts of reasons. And the kicker is almost everything a mother takes can find its way to her baby. That's why being careful and informed isn't just a good idea, it's essential.
So, that leads us to the million-dollar question. How do we make safe choices? It's this incredibly delicate balancing act, you know? You've got the mother's health on mom's side and the baby's safety on the other. So today, we're going to unpack exactly how everyone involved, doctors, parents, can figure this out together.
Okay, first things first, let's be really clear about something. The answer isn't just don't take any medicine. That's not realistic, and sometimes it's not safe. A pregnant woman might need medication to manage something she already has, like diabetes or high blood pressure, or new issues can pop up during the pregnancy. The goal is never to stop necessary treatment. It's about figuring out how to do it safely. Now, one of the most critical pieces of this whole puzzle is timing. When a drug is taken makes a world of a difference. I mean, a medicine that might be totally fine at one point in a pregnancy could be really, really dangerous at another stage. It's all about that developmental timeline. So let's actually look at that timeline. It's broken down into three main stages. First, you've got the first 2 or 3 weeks. That's called blastogenesis. Think of it as just a period of super fast cell division. Then, from about day 14 to day 56, we hit organogenesis. And that name tells you everything. This is when all the major organs are being built. And finally, from week 9 all the way to birth, you have the fetal period. That's all about growth and getting everything ready for the outside world.
Okay, so here's why those stages matter so much. The kind of risk changes depending on when we are on that timeline. During organogenesis, that super sensitive window when organs are forming, a bad drug can cause major structural birth defects. But later on, during the fetal period, the risk is different. It's less about structure and more about things like the baby's growth, how well their organs work, or even if they'll experience withdrawal symptoms after birth.
So you might be wondering, how do these drugs even get to the baby in the first place? Well, the answer is the placenta. A lot of us have this image of the placenta as this perfect, impenetrable barrier, right? Like a shield. But that's a huge misconception. It's way more accurate to think of it as a gateway. Think about it. The placenta's job is to let all the good stuff through. Nutrients, oxygen, you name it. It's the baby's lifeline. But the problem is that same super efficient delivery system doesn't know the difference between a vitamin and a medication. So most drugs can hitch a ride right along that same pathway, moving from the mother's blood straight into the baby's.
Of course, it's not like every single drug zips across with the same ease. There are a bunch of factors that determine how easily a drug can get through that gateway. We're talking about things like the size of the drug molecule, how easily it dissolves in fat, how it sticks to proteins in the blood, all sorts of stuff. But let's start with the easiest one to wrap our heads around: size. So, molecular weight, it's just a scientific way of saying how big the drug molecule is. And it's pretty simple. Small molecules can slip through the placenta, no problem. But really, really big ones, they get stopped at the gate. A classic example is the blood thinner heparin. Its molecules are just too massive to cross over, which is exactly why it's considered a much safer option during pregnancy, compared to other anticoagulants with smaller molecules.
Okay, with all this complexity, how does a doctor even begin to make a decision? Well, to help with that, the FDA came up with a classification system. Think of it as a framework, a guide that puts medications into different categories based on how risky they are for a developing baby. It's a tool to bring some order to a very complicated situation. Basically, it's a spectrum. It goes from category A, which is the absolute safest, all the way down to category X. And category X means do not use ever during pregnancy. It's a clear-cut warning. So you've got this whole range of risk levels to help guide those tough calls.
Let's actually break that down a bit more. Category A, that means we have good studies in humans that show no risk, gold standard. Category B is also pretty low risk, but maybe the human studies aren't as solid. Category C is the gray area. Risk can't be ruled out, so you really have to ask, is the benefit worth the potential risk? Then there's Category D. Here, we have actual evidence of risk in humans, but the drug might still be used if the mother's life is on the line. And Category X, no debate. The risk to the baby is so high, it outweighs any possible benefit. Full stop. All right, so that covers pregnancy. But what about after the baby arrives? The game changes, but you're definitely not out of the woods. When we start talking about breastfeeding, there's a whole new set of rules and considerations for medication safety.
And you know what? Let's start with some good news on this front. Yes, a lot of medications do get into breast milk, but, and this is a big but, the amount is usually tiny, like so small it's very unlikely to harm the baby. And since breastfeeding has so many amazing benefits, in most situations it's totally safe to continue, even if the mom needs to be on medication. But it's not just about the baby. Some drugs can actually mess with the milk supply itself. It all comes down to a hormone called prolactin. That's the stuff that tells the body to make milk. Well, some medications can lower prolactin levels and, you guessed it, reduce the milk supply. On the flip side, some can actually boost it. But, and I have to be really clear here, that doesn't mean we can just throw caution to the wind. There are absolutely documented cases where drugs have caused problems. We're talking about things like extreme drowsiness from diazepam or irritability from fluoxetine. And then there are really serious risks, like with codeine, which can cause a fatal overdose in some babies who process the drug too quickly. It's a stark reminder that every single medication decision has to be made with care. Okay, we've covered a lot of ground. Pregnancy, breastfeeding, risk factors. So what does it all boil down to? What are the big takeaways? Well, it all comes together in a set of core principles that guide doctors and parents in making the safest possible choices for both mom and baby. Let's run through them. Rule number 1, only prescribe a drug when it's absolutely necessary. And if you can, try to avoid meds in that super critical first trimester. If a drug is needed, pick one we know a lot about, use the smallest dose that works, and for the shortest time possible. Also, a big one, avoid polypharmacy. That's using a bunch of different drugs at once. And throughout it all, you're constantly weighing the mom's health against any potential risk to the baby. And once the baby is here, you have to watch them closely for any side effects. And maybe most importantly, this is a team decision. Both parents have to be part of the conversation. And really, all of this brings us back to that one central question that drives everything in this field. It's this ongoing, ever-changing challenge. There's just no simple one-size-fits-all answer here. It always comes down to knowledge, to caution, and to creating a personalized plan for every single pregnancy. Ultimately, it's about finding that perfect, delicate balance, making sure the mother is healthy and well, while giving her child the absolute safest start in life.